If you are menopausal or perimenopausal, it wouldn't be surprising if you felt a change in your sex drive. In particular, if your sex drive was lower than it used to be. We also call this a low libido, low sex drive. We kind of use those terms interchangeably. But a low sex drive is something that often happens to women when they get into the menopause or perimenopause stage. Why, you're wondering? Well, one of the reasons is because of estrogen. As we get into perimenopause and menopause, our estrogen levels decrease, and that can change our desire for sexual activity. Now, there are lots of other causes of a low sex drive in women. That's what we're talking about today, guys. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do tons of videos and all sorts of things. Actually, I decided to do this video because I have a number of videos on what happens to your vagina as you age, what happens to your vagina if you don't have sex for a long time. I have videos for men as well, don't get me wrong, but there are so many people, women in particular, who commented about how their sex drive is lower than it used to be. So this video is all about giving you the causes, or many of the causes, of a low sex drive. Menopause and perimenopause is the first one I wanted to mention, okay? So that could be the reason for your low sex drive. Let's go to a few causes that can actually be experienced by men and women, and then we're going to go back to other women-specific causes of low sex drive. The next one, relationship problems. And this sort of goes without saying, but it's something a lot of my patients don't necessarily think about. If you're having problems with your partner, you may not be interested in having sexual activity with them. And don't underestimate that, guys. It is not uncommon. If you are fighting, fussing, not communicating with your partner, etc., that is a big trigger for, or rather sort of a trigger for not wanting to have sex maybe, or feeling like you have a low libido could be due to relationship problems or stress. So keep that in mind. Speaking of stress in general will do it too. If you are stressed, overwhelmed, whether it's because of the world we live in, because of work, because of family things, your libido can also take a nosedive. You simply may not be interested in sex. And that kind of makes sense because you're probably focused on other things. Stress can definitely do it, but also kind of still along that path, things like anxiety and depression. Okay, mental health conditions can decrease our sex drive just by the nature of having them. When you are depressed, when you are anxious, you are likely experiencing a number of symptoms, but also what can go along with that is just not being interested in sex. Okay. And by the way, sometimes mental health medications can cause a low sex drive. I'm going to get to medications that can cause a low sex drive, so just stick with me. Also, a history of sexual trauma can certainly be a nidus for low sex drive for many women, even men as well. And then medication side effects as well. Medication side effects can exist for men and women, sometimes different medications for both. So even though this video is for women, I'm going to give you some that can do for both. Antidepressants can decrease your sex drive. Blood pressure medications can do it for some. Chemotherapy can lower sex drive, also psychiatric medications, but specifically for women, hormonal contraception can do it. Hormonal contraceptives, I've absolutely had a number of patients over the years of my practice feel like their birth control, affected their sex drive. That is not uncommon, so women keep that in mind. Also, smoking, drugs, alcohol for both sexes, okay, can decrease your sex drive. Let's go now to more female, women specific things, okay? So let's go back. We first talked about perimenopause and menopause. I also mentioned particularly with medications, I said that hormonal contraception can do it. Let's talk about sexual dysfunction. So one of the things you guys have talked about a lot in some of the videos I've done is you've mentioned how whether it's vaginal dryness or pain during sex, etc., some people have vaginismus. If you have sexual dysfunction or any symptoms like I mentioned, you could, as a result, have a low sex drive or low sex desire, low libido. Sex simply may not be pleasant for you. And as a result, or sort of concurring along with it, can be a decreased interest or drive to have sex. So don't necessarily dismiss any sort of symptoms you have during sex, because they could absolutely be affecting your sex drive. By the way, vaginal dryness, painful sex, etc. So many of you guys have written me about those. Do not blow those symptoms off, okay? I have a video on vaginal dryness, other videos, but talk to your doctor, talk to your gynecologist. There are things that we can do to help you. You do not have to live with this, nor should you, okay? The next thing is, we forget women, depending on how many children you have or have had, you might have spent a decent amount of your adult life pregnant, depending on how many kids you have. Remember, pregnancy, childbirth, breastfeeding, all of those states in a woman's life is a state of sort of major fluctuations of hormones. That hormonal fluctuation, although all of this can literally change your sex drive, affect your sex drive, cause a low libido. So you might have found that when you were pregnant or when you were breastfeeding, etc., or postpartum, your sex drive might have taken a nosedive. And it wouldn't necessarily be unusual in the sense that hormones are fluctuating during those periods during our life, just like they do during menopause and perimenopause, right? So we talked about that, which is when estrogen decreases, and that's often a time of low libido. Also, women can get a temporary loss of libido with certain illnesses or infections that we may have. If you have a urinary tract infection, if you have a vaginal yeast infection, sort of these temporary conditions that, yes, are treatable, but you may be going through during these different spells and phases in your life, it would not be uncommon for you to have a decreased sex drive, okay? And we also did talk about like chemotherapy, cancer patients. If you're undergoing cancer, your sex drive simply may be lower. That wouldn't be unusual. And then also cancer drugs that treat cancer, chemotherapy agents, as I mentioned before, can also lower sex drive. Okay. The other thing that is specific to women is, we talked about hormonal stuff, etc., but some of like the GYN conditions that we can get. So PMS or premenstrual syndrome, premenstrual dysphoric disorder. If you get severe mood changes around your period, that could change your sex drive. You might have a lower sex drive during that time. If you have endometriosis, okay, that may decrease your sex drive. Other GYN conditions that you may be dealing with may have, even PCOS has been listed as a potential cause for lower sex drive, okay? By the way, I do want to say the source for the information in this video is the Cleveland Clinic. I really loved how they laid things out. Perhaps I'll do a video for men on what can lower a man's sex drive. Let me know if you guys are interested in this. But I do want to make it clear that I don't want you to feel alone if you have a lower sex drive than what you used to have. The other thing I need to say, though, is that sex drive is very individual. No two women are created equally. Your sex drive is not going to be the same as your neighbor's sex drive or your coworker or your sister's sex drive. It's your own. So some people just naturally have a higher sex drive. Some people have a lower sex drive. Do not let that throw you off. You are who you are, and that's okay. When we talk about a lower sex drive in this video, we're talking about lower than what your usual or your baseline is. Understand, I think the biggest thing is that a low sex drive for many of us, for many women, there are many what we call reversible causes that I mentioned, meaning with treating depression, anxiety, perhaps, or by changing medications or by switching birth control. Many of the conditions I mentioned could potentially be reversible. And so I want you to know that if you have a low sex drive, there may be hope, okay, in terms of switching that around, okay? Now, if your low sex drive still persists despite changing things, investigating with your doctor, you need to continue to look further because there are other conditions that may be there, okay? Guys, I hope this is helpful. A low sex drive is very important. Your libido is important. Your sexual health is important. Don't let anyone tell you or shame you into thinking it is not. And there are plenty of reasons why a woman may have this. Let me know what your thoughts are. Let me know what you think about this video. Share this video with other people who you think might benefit from it. Let me know if this is you, if you have a low sex drive, and if you know what that's due to or what you've done to help. Sometimes what you say actually helps other people. I'm Dr. Jen, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of health topics. On Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. Consider joining my subscription groups. I have them on Facebook, Instagram, and YouTube for exclusive live content once a week. We do these fireside chats and stuff. It's a lot of fun. Also, go to my website to check out my website, my blog, but also I have a free health newsletter that comes out every week. Guys, I hope this is helpful. Love y'all.